everybody. My name is Donna Nauman, and I'm a nurse practitioner in St. Louis, Missouri. I've met some awesome providers here in St. Louis as well, providers that I feel like patients need to connect with. I am going to be doing something that I call HOPE, helping other people everywhere experience and have the ability to have optimal health. One of those things are learning about how to find great providers to take care of us. Today, I am honored to have Dr. Mike Twyman. He is a cardiologist here in St. Louis. So, Dr. Twyman, tell us about yourself.
Well, thank you for having me on your show today. I'm honored to be the guest. So, my name is Michael Twyman. I'm a cardiologist. I was trained in the traditional Western way, and I kind of got tired a little bit of just taking care of people at the end stages of heart disease. So I decided to do a lot more research into integrative functional medicine, and been really trying to get to the root cause of people's cardiovascular issues for the past 7 to 8 years now.
What got you so passionate about changing the way that cardiology is done?
Well, my third year of cardiology fellowship, so I did 4 years of medical school, 3 years of internal medicine, and 3 more years of cardiology. And at the end of that 10 years of training, I really thought I was going to be an invasive interventional cardiologist and be treating people's heart attacks with stents and bypass, and not necessarily bypass, that's what the surgeons do, but sending people off for bypass who had severe disease. But then kind of got not necessarily disillusioned, but the same people kept coming back and back and back. And the stents were Band-Aids. They weren't really fixing the people. And so I really fell down the path of looking at what are some of the other causes? Because if we were fixing their blood pressure, their cholesterol, their blood sugar, they still kept coming back. It's like we had to be missing something. And then when I found kind of Dr. Mark Houston, I learned that there's maybe up to 400 different things that really drive cardiovascular disease, and we were only touching the tip of the iceberg. And we're treating people way late into the game. And so I kind of backtracked and said, well, let's look at it much, much earlier.
Yeah, I think it's interesting. Wouldn't you say in practice, like there are some key marker things that are going on long before the patient shows up in the office?
Oh, for sure. I mean, vascular disease is a slow chronic thing for most people.
Mm-hmm.
And unfortunately, people don't necessarily have symptoms until they have symptoms. I think one of the facts that is, very surprising is, that, the first sign somebody has heart disease is sudden cardiac death in up to 30% of people. So they have no symptoms until they fall over dead. And that's, obviously extremely late to the game unless they get resuscitated. And there's ways you can look at the health of the arteries way before that happens. And definitely independent of just looking at somebody's cholesterol and their blood pressure, there's a lot of other markers and things you can do.
I think it's interesting in medicine right now, like at our office in the modern Western world, really, we're just doing a cholesterol check, and it really just offers 4 different numbers. And would you say there are more numbers that people need to know about?
For sure. And the standard lipid profile is a starting point, but it's not anywhere sufficient to tell you what your risk is. Half the people that come in with heart attacks have, quote, normal cholesterol. So if cholesterol was the boogeyman that was giving you the heart attacks, treating with statins and other medications, we would have eliminated all heart attacks by now. And in the traditional panel, unless your total cholesterol is over 300 or your LDL-C is over 190, which would generally indicate you have a familial issue,
right,
which about 1% of the population has, those numbers really don't predict risk at all. The only numbers I really look at in traditional panel right now are your triglycerides, which are basically your stored up sugars, and your HDL, which is a good marker of how healthy your liver is. And it's that triglyceride to HDL ratio that tells you, are you insulin resistant or not? You'd like that ratio to be less than 3. But in my practice, for at least the past 7 to 8 years, I've been doing the advanced lipid testing where you're actually checking the LDL particles. Particles are what actually predict the risk. The cholesterol is this waxy substance, can't float in the blood. So it gets wrapped up with these particles, and the particles drive them where do they need to go. It's like a passenger is the cholesterol and the particle is the car. It's more important to know how many cars on the highway than it is the passengers, because it's the cars that determine if there's a traffic jam in the arteries.
Yeah, I think a lot of patients are like, I know, like in our practice, we would put patients on cholesterol medicine, and they still would have events, and their numbers would look really good. And like when I met you at the St. Louis Integrated Medicine, learning about different kinds of labs like the Cleveland labs, and starting to do A1Cs a little bit earlier to find pre-diabetics a little bit earlier because of the inflammation. Wouldn't you say that inflammation also has a lot to do with what's going on in the vessels?
For sure. And, it's inflammation, oxidation, which is basically rusting, and then autoimmune dysfunction, where your body's attacking itself. Those are the three kind of really root causes of vascular disease. Cholesterol, that gets damaged is always going to be present in the plaques that are building up in the 60,000 miles of blood vessels. But the cholesterol by itself is not usually the starter point. It's the inflammation. The arteries are on fire. Your body's trying to repair that damage. And it's during that repair issue, or I should say during the repair mechanism, that the cholesterol is getting damaged, and now it's getting stuck in the arteries.
So tell us you started the company, and it's called Apollo. You want to tell us a little bit about that?
Sure. So I launched my own solo practice last August 2019. The practice focuses pretty much exclusively on heart attack and stroke prevention. If you have other general cardiovascular needs, I'm still happy to address those things, but I really want to get a little bit to the earlier stages and treat people before they even become symptomatic. I'm not saying that it's too late if you've had a previous heart attack, stent, bypass. I still work with those patients and work to prevent second events. My goal is not let them get to that point in the first place. And there's some tests that you can get done that really look at the health of the arteries earlier than when you're going to fail a stress test. Because by the time you fail a stress test, you likely have a 70% blockage in one of your arteries.
Yeah. So tell us about some of the testing you're doing.
So thanks for asking. I typically will say that there's three major tests that I recommend if people really want to know how healthy their arteries are. The first test, and this is the one I always recommend if anybody's over the age of 40 or has multiple kind of cardiovascular risk factors, it's a test called the CT coronary calcium score, or calcium scan. It's a $100 x-ray of your heart arteries, very low dose radiation. And it's looking to see if there's any calcium building up in the walls of your heart arteries. You got three arteries that sit on the outside of your heart. Your heart's about the size of your fist. The arteries sit on the outside of it and supply nutrients to the heart itself. Calcium is supposed to be in your bones and teeth. It's not supposed to be building up in the walls of your blood vessels. So if calcium is building up in your blood vessels, that's a marker that plaque is present. And the higher the calcium score, the higher the risk. So anything over 400 is a high risk finding. Anything over 1,000 is very high risk. The idea want to be a zero. Zero is a perfect score. You're extremely low risk if your score is zero. And that zero score can also be a very good tiebreaker for when people are saying, well, should I be concerned about my cholesterol? Should I consider taking medications for cholesterol? If your score is zero, the data is pretty clear that you probably should not necessarily be taking prescription meds. You should just be working with your lifestyle and maybe supplements. If your score is over 400, then you may be considering pharmaceutical intervention to start lowering that risk. So that's always the first test I recommend. And then the two more novel tests that I recommend, one's a carotid scan called a carotid intermedial thickness scan, or CIMT. It's an ultrasound of the neck artery, where it's not necessarily looking at the flow of the blood, it's looking at the thickness of the walls of the artery. The thicker the walls, the more inflammation is in that wall of the artery. And you can't see plaque if it's present, don't comment on it. But this test will give you a vascular age. So if you're a 45-year-old man and your arteries are 65, you're theoretically actually 65. It doesn't matter what you look like on the outside, it matters what's going on in the inside. And then you implement some kind of a change in your lifestyle, your supplement, your medication regimen, and things go according to plan. You repeat the scan in a year, you'll see that thickness improving, and you'll actually be, having your vascular age improve.
Nice.
So those are the two tests I look at to look at the actual structure of the blood vessels. You have 60,000 miles of blood vessels, so you're looking at the two major territories with those two tests. And then the third test I recommend patients consider getting is a test called an endopap, which tests your endothelial function. The endothelium is the inner lining of your blood vessels. It's one cell thick, and if you took out all your endothelium and laid it flat, the surface area of 6 tennis courts. So it's actually one of the largest organs. From a cardiovascular standpoint, the major thing that it releases is something called nitric oxide. Nitric oxide is a gas that dilates your blood vessels, and then also acts somewhat like Teflon, prevents stuff from sticking to the blood vessels in the first place. So if you have a lot of nitric oxide, you're much less likely to get heart disease or plaque building up. Endopap test will actually measure how healthy those arteries are. It's a non-invasive test, takes about 15 minutes. It will tell you how much nitric oxide gets released. If your arteries can double in size, your arteries are healthy at that point. So it's literally like a stress test to the arteries that day.
Wow.
You look good on the outside, but if your arteries don't dilate, you're at more increased risk. That endothelium isn't working appropriately. And when the endothelium doesn't work appropriately, things tend to get below the endothelium and start building up in the walls of the artery. And that endothelium damage can actually happen maybe up to 7 years before you actually start putting plaque in the arteries. So it's a very early warning sign. It's actually the first sign that you're developing vascular disease is when the endothelium gets dysfunctional. And if you change up your lifestyle and potentially supplements and potentially medications, you reverse the endothelial dysfunction, you won't put the plaque in the artery in the first place.
Well, I think it's true that we've seen people that look completely healthy and have fairly healthy lifestyles that have heart attacks unexpectedly. So I think it makes sense that we're trying to do things a little bit earlier and do a little more prevention. One of the interesting things, like at our office, like we always listen to the neck, to the carotids, and we're listening to see if we hear a brewery in there, and then we send patients for those ultrasounds that you're talking about. At what point, when you start to hear things, where are you in the game?
Sure. So there is a slight differentiation between the cardiologist on the order for a brewery that you hear. So the brewery is just turbulent flow.
Right.
And for people that in the medical field, it's like putting your finger over a garden hose and you just hear the whooshing. That's just the blood whooshing through a stenosis. But likely you probably have a 50 to 70% stenosis or greater if you're hearing it with a stethoscope on their neck.
Right.
And so they use the same piece of technology, the ultrasound, to measure that. They're measuring the speed of the blood, and that gives you a percentage essentially of how blocked that artery is. But on the CIMT, they use that same probe, but they use a different software platform just to do the measurement. So a usual carotid duplex won't actually do that measurement. You need a special software package to get that.
Gotcha. But I think the point being that sometimes we're finding the late findings at the office. You're going to be finding things long before we ever start hearing any noises in the neck, basically.
Right, and no, that's excellent that you're doing that. I encourage any healthcare provider that isn't a vascular specialist. You may not be able to quantify a cardiac murmur, but you hear something abnormal. But it's pretty straightforward. You hear a whooshing there, or you don't. If you do, you need to send them on to a vascular specialist to try to figure out what's going on there. Because maybe they just have plaque here, and that's a high-risk finding, and they don't have plaque here, but they need to make sure their heart's safe too.
Right, absolutely. So I was also looking at some stuff. You're doing optimization of health. How would you explain what your optimization program looks like?
So, health optimization, I kind of got into that field, when I started following a lot of the biohackers online. So biohacking, involves changing your environment to improve your own biology, and really got into it mostly based off of trying to not have really bad jet lag flying to Asia a few years ago and came on these blue blocking glasses that reduce jet lag. So for the past 3 years, I've really been deep into the light water magnetism of how your health is actually put together. And then that kind of led me to really reading a lot more about how mitochondria actually work. And the
mitochondria, can you just kind of say what that is for?
Sure. The mitochondria are the organelles in your cells that make energy for you. And your heart and brain have the most mitochondria because those are the areas that require the most energy.
So if you're tired all the time and you're having fatigue issues, would that have something to do with our mitochondria?
In many cases it is, yes. If every mitochondria don't make enough energy, you have an energy brownout. That's where you're going to get issues. And so since the brain and the heart have the most mitochondria, those are the two places that most chronic diseases really kick in. But fibromyalgia, chronic fatigue syndrome, those can all be related to dysfunctional mitochondria. And one thing that I do a little bit differently is when I take a history of a patient, yes, I care what their dad's history is and their siblings, but honestly I care what their mom's history is and your mother's mother, your maternal grandmother. Because your mitochondria are inherited maternally, meaning you get your mitochondria, your starter packs from your mom. So if your mom's healthy, you get a good set of batteries to start with. If your mom had cancer, autoimmune conditions, heart disease in early age, she had weaker mitochondria. You then likely inherited those weaker mitochondria. So you're born at age 0, but your insides could be 30 years old. And so when you start developing diseases in your 40s, we're actually 70 inside for the most part. So that's why people can have different ages where they get issues. And, I don't know if someone has talked to me about COVID, but this is the reason why a lot of the younger people who get COVID and die, it's likely they had dysfunctional mitochondria to begin with. It's not that they, were the healthiest things that they could have been.
Right.
But back to your, kind of the original question, the mitochondria, the more things that you can do to optimize them and let them make energy, the better you do long term. And that's what health optimization really helps with.
Hmm. And do you do things with the circadian schedule as well?
And that's probably the number one thing that really does drive the mitochondrial function. So circadian is around a day. It's your 24-hour cycle. It's how you make your different hormones, neurotransmitters. And for the most part, your 24-hour cycle is regulated by the light that enters your eye, hits your skin, and also by the timing that nutrients come into the system. Light is even probably the most critical of the Zeitgebers, a German word for time giver. So your body is very receptive to the environment, and the light outside essentially is like a GPS clock telling you what time of day it is to your body all day long. So you need to keep going outside multiple times a day to kind of keep resetting that clock. Same thing with the timing that the nutrients come into your system. You literally have these clock genes in front of the liver and the gut that get turned on when nutrients come in. Ideally, you want those clocks to shut off 12 hours after stuff comes in. So this is the whole area of time-restricted eating.
Mm.
The more that you can kind of fine-tune the body's clocks, the mitochondria know exactly what they need to do. And then at nighttime, when you sleep, you repair any damage that's gone on throughout the day. Or if there's cells that just can't make it anymore, your body gets rid of those cells. So if you're exercising like a beast and you're eating all this clean, healthy food, but you don't sleep well, your mitochondria never get repaired at nighttime. So it's not that it's worthless to do those things, but you got to focus on your sleep so that your mitochondria can do what they need to do.
Very nice. I know that one of the first times I ever met you, you had the blue blocking glasses on. So of course I have to show everybody that I also have a little pair of blue blocking glasses. And then I did last time I got my blue blocking glasses. Do you ever get these when you get your glasses? So like this is a blue light and it goes on this card, and what ends up happening is you can see where the blue light was actually hitting, and this has something to do inside of our eye. Is that right?
Correct. So inside your eye, there are basically blue light detectors. There's a receptor called melanopsin, but that receptor is not only inside your eyes, it's on your skin. And so when the body senses this blue light, cortisol levels increase, and increase some other neurotransmitters as well. Um, and blue light, when it's from Mother Nature, isn't a problem because it's always balanced with red light from the sun and other colors from the sun. It's
Mm-hmm.
the excessive blue light from the technology that can cause a problem. But one caveat, I know with those light things that you were just showing,
Uh-huh.
it's very tricky on the nomenclature because it really matters on the wavelength or the frequency of light that gets through the lens. Most of those little blue light pens, they're near 400 nanometers.
Uh-huh.
That's the less intense blue light. You need to block 450 to 465 nanometers.
So a little bit
And
higher.
a little bit higher. And so a lot of those clear blue blocking glasses or the prescription glasses, if they just have a clear coat on them, they're not blocking the necessary frequencies of blue light to really allow the mitochondria to function well.
So to help patients understand this a little bit better, we're talking a little bit about blue light. Where are we getting that blue light? Where are we being exposed from the blue light?
The major sources are from your screens, the backlit screens from your computer, your phone, your tablet, even your TVs, have a very high spike of blue light compared to red light. In Mother Nature, those things are always balanced.
Mm-hmm.
It's that mismatch of that color that your body gets a signal that it's basically noon in July all the time when it's exposed to that color light. Um, and so this is one of the things that's really driving a lot of people's sleep dysregulations because they're on their devices late into the evening time. It's telling the brain, stay awake, it's daytime,
Wake up.
but you actually need 4 hours of darkness before the melatonin that your body's been making throughout the day to get released. And it's like a seesaw, cortisol and melatonin. Blue light raises cortisol, keeps melatonin levels down. So if you always have blue light in your eyes, you'll keep cortisol up and you're not going to sleep well. If you block the blue light, the melatonin levels are able to be released, and then you go into your deeper levels of sleep.
But I think I hear you saying that there's also different brands of glasses. So like if you're getting the blue blocker, you need to be very specific about what it's blocking. And did you say over 400?
Well, typically for Computer type work, you're wanting to block between at least 450 and 465 nanometers. So the glasses, by definition, are going to have to be somewhat yellow. There's no such thing as a completely clear blue blocker because blue and yellow are complementary colors. So to be able to block blue, it has to be a yellow pigment. The darker it is, more of the amber, you're blocking even more of the blue light. For optimal, I think people should have 2 pairs of glasses. But if you're only going to get one that's the yellow pair. And wear it anytime you're inside, in front of a computer, or I should say also, the backlit scripts are the main sources, but also your artificial light, your LEDs, your fluorescence, all that has big spikes of blue light as well. But anyway, indoor sunglasses. Anytime you're in front of a computer, phone, tablet, TV, or have your lights on, you put these things on. And then in the evening time, once it gets past sunset, you can swap these ones out for a darker pair that have more red lenses. The red lenses block all the blue frequencies and the majority of the green frequencies. The green is also stimulating. So if you really want to preserve melatonin or you have a really hard time sleeping, you want to upgrade to the ones that block 100% of the blue light. And they have to be red to be able to actually do that.
Isn't that something? And I think, we've gone from this place in life where we used to go outdoors all the time, and now we're indoors. And then you hit COVID, and now we're on the computer screen all the time, under light all the time, and getting very little outdoor. And what else do we get outdoor, like from the sun?
So there's Mother Nature included all the wavelengths that your body needs, and the different wavelengths come at different times of day. Mm-hmm. So the number one health tip I recommend anybody, and I haven't missed one since January 2019, is seeing every sunrise. Aww. The sunrise has the full rainbow of colors that you need in the morning time to start your hormonal cascade for the day in the right way. So first time outside at sunrise, no glasses on, nothing between your eyes and the sun. That turns on the clock in the brain. Then mid-morning or so, depending where you're at in the universe, your latitude will determine this. But here in St. Louis, UVA radiation comes out mid-morning, is gone mid-afternoon. So UVA radiation is what, when it hits your skin, releases nitric oxide. What we were talking about earlier, that nitric oxide helps with your endothelial function. That's one of the number one things that helps. That's the number one thing that will actually help lower your blood pressure by Mother Nature is UVA.
Who would have known this?
Took me a little while to figure it out and a lot of reading, but that light helps with blood pressure and endothelial function. Then a little bit later in the morning, that's when UVB radiation comes out. So that's what can make vitamin D on your skin from cholesterol. So vitamin D is a very important surrogate for how your immune system is going to work. And vitamin D is not a vitamin pill that you pop. Vitamin D is actually a hormone that has hundreds of reactions in the body. Right. But from a COVID standpoint, it's a good marker for how your immune system is going to work. So vitamin D, if your levels are really low, you got 2 problems because you got 2 sides of your immune system. You have your innate immune system and your adaptive immune system. If you have low vitamin D, your innate system doesn't work very well, so you're more likely to catch COVID. And then if you catch COVID, your adaptive response doesn't do a great job. Sometimes it overreacts, and then you have all these cytokines. You have a cytokine storm, and your body's trying to kill this infection, but your body dies in the process while killing the infection. People who have more optimal vitamin D levels naturally, their innate system works better. They're less likely to catch viruses, not just COVID, all viruses. And then if they do come down with the virus, their body's adaptive system doesn't hyperreact. It doesn't basically kill the host. Yeah. That was the big problem in the 1918 flu, was that up to like 50 million people died during that. And it was mostly younger people because they had these really aggressive cytokine storms and their body just shut down and killed themselves.
Huh. Interesting. I know at the office, we always check vitamin D levels, and I think it's like some people have less than, like they have absolutely none. And I'm very fascinated by that because there's very rarely a patient that comes in the office that has a normal vitamin D. And I consider normal a little more towards 50, and most people in my practice had been under 20. Would you say you kind of agree with that?
Correct. I kind of, ballpark, it depends on people's context, but ballpark shoot for levels between 50 and 60. And, anything under 30 is considered deficient.
Yeah.
And so, the way I recommend people do it is, the way Mother Nature intended it. There's for people, it's a free app. It's called D-Minder Pro. They have it for both iPhone and Droids. and it just tells you what time of day to be outside to optimize making your vitamin D for your skin type. Because the darker your skin, the more sunlight you need. So that's why I can't say, oh, everybody should get 20 minutes a day of sun and they'll be fine. No, if you're a very light Fitzpatrick type 1 skin, you don't need that much. You're very dark equatorial African, you need 5 times as much sun as that person. So it depends on what your skin color is to begin with, how much sun you need.
Yeah. Do you know how much time are people actually spending out in the sun?
It's extremely low. You mentioned earlier, I mean, there's days that people are living inside up to 90% of the time.
Ugh.
And that's, I know offline you were asking about kind of sunscreen, maybe we'll go there a little bit, but the reason people have a lot of issues with their skin burning and these skin issues is that they stay inside 90% of the time, and then they run outside at noon thinking they're just going to get their vitamin D, and they've never really preconditioned their skin throughout the day to be able to get that high level of UV radiation.
Uh-huh.
UV radiation by itself isn't the problem, it's just that you're getting it at the wrong time of day with untreated skin. If you slowly build your solar callus up, you can tolerate a lot more sunlight in the midday and not burn, not injure yourself. So you gotta know what you're doing. That DMONDRAP Pro gives you an idea of directionally where to go, but I'm happy to work with patients directly and tell them, okay, this is exactly how you do things.
So give us kind of a synopsis. A patient comes in, how do you look at them overall, and then you do your diagnostics, and then when they're getting ready to leave, that assessment plan type thing that you do with them.
So when patients come in to see me at Apollo Cardiology, I've already sent them out a fairly extensive lifestyle questionnaire that goes through basically a circadian day. How much normal light are you being exposed to? What time of day are you eating? What is your mom and her mom's health? A list of all your supplements, obviously all your medications if you're on any medicines, and then what previous cardiovascular testing you had, if any. Then when they come in, thorough history, any current symptoms or anything that they're actually concerned about at that point, examine them, and then figure out which test is most appropriate. But if they're the right age, usually try to get them to do the trifecta. So
Yeah.
how healthy are they already today? That's the endopad. How old are you? The carotid scan. And then did you ever do damage to your heart? Get a calcium scan. And if you get those 3 tests, you'll have a great idea of how healthy the heart is at that point. And then I also will do the comprehensive blood work panel that looks at many inflammation markers, the advanced particle, lipid particle numbers, and some genetic markers. But the labs are important. But I actually probably backed down a little bit over the past 1 to 2 years on how important the labs are. So the labs are just a reflection of what you're doing in your environment. So if somebody tells me that they never go outside, they don't sleep well, they're on their computer all the time, I already know what I'm going to see when the labs show up. It's the labs are just confirming what I know,
right?
And just what their baseline is. But sometimes you'll find things in the blood work like lipoprotein A, which 20% of the population has, and increases the risk of a heart attack by 2 to 3 fold over the general population. You'll find that. And when you see plaque in the arteries, this is probably why you're getting plaque in your arteries. It's not necessarily you have bad cholesterol. You have some other things that are driving that risk. And so
you have a family marker that might be driving your risk, and you test for that. Because I don't think most cardiologists are not testing for that.
Not routinely yet.
Yeah.
And it's about $20 test from even the Quest and LabCorp. It's not an overly expensive test.
Yeah.
And you only check once. If your levels are normal, you're not a carrier of the gene that makes you have high levels of it. 20% of people will have a higher level. So if your mom or dad had a heart attack in their 40s, it's a chance that they had this thing. You should get checked at least once. And if your levels are high, this is where it gets debatable. What do you do about a high level of LPLA? There's not great treatment options for it this time. There's trials that are ongoing with some pharmaceuticals to say that are lowering it, but are they lowering heart attacks, strokes? Are you not dying as much?
Right.
So if I see LPA, I just know it's a higher risk finding, and then I try to fix everything else that I can fix at that point.
This is such good information. So now you have the patient, you've done some testing, and you've done their labs. What kind of recommendations do you generally give them as their, to help them optimize their lifestyle? And
Sure. So it's mostly going to come down to your environment again. Yes, there's a place for medications. Yes, there's a place for supplements. When there's true deficiencies that you find in the lab work, but focusing on their circadian rhythm. So how are you sleeping? If people say they can't fall asleep, stay asleep, or both, many times it's the light environment that they're exposing themselves to. Many times it's they're eating too late and they're keeping their machinery on too late. So you try to fix their circadian rhythms. Once those things get regulated, the body has an amazing ability to heal itself. as long as you get out of its way. And then, there are certain supplements and things that I'll recommend to patients that have been shown to help stabilize plaque and start getting it to regress. But that's tailored to each individual depending on what the results are.
Very nice. So it sounds very comprehensive.
Definitely is. Yes.
Yeah, I think I think everybody would want to do that. I mean, you have I guess like when I think about this for myself and for patients, I think often we are waiting too long, and by the time we figure out that we have something going on, it's harder to fix, as you said, kind of a band-aid problem. I think every person needs to start prevention. Like that should be where everybody starts. Would you agree with that? And
Oh, definitely. I mean, I think people's health is, the greatest investment. Without your health, you don't have your wealth.
yeah,
Um, and, too many times, medicine is reactive. You have a problem, we try to fix it. Something hurts, we try to make the pain go away. But taking a proactive, not reactive stance is really the key. So, you can find it, 7 years before they're going to have a problem and you reverse it. Well, it's a whole lot less costly to the patient and the system to fix it that early. And also then, the patient doesn't have to suffer the event and they can go about doing what they want to do with their life and doing the health optimization, the biohacking stuff. Well, if I can give you more energy, even if it's not, for a cardiovascular reason, but now you can play with your kids or do what you want to do, that's always going to be beneficial. Energy is the ultimate currency. We
yeah,
all have the same amount of time in this world, at least we think, or at least in a day, but we don't always have the same amount of energy. So there's some
yeah.
people that can get twice as much done as others. Well, how do you get more energy? Really focus on your circadian rhythms and optimizing your mitochondria.
hmm I often tell patients, nobody's coming. Like you have to start doing things for yourself. Finding providers that are doing prevention, finding providers that are running the tests that you need, doing some of the testing things that you're doing. And this is our heart. I mean, like this is we don't live without that. And that kind of makes what you do a pretty big deal. And how do patients find you? Like, if we're looking for you, how do we find you?
So I have a practice here in St. Louis, Apollo Cardiology. My website is .com. I'm very active on Instagram, same handle, Dr Twyman. Frequently have kind of my biohacks and the things that I'm doing for myself. I put on my Instagram stories daily, so pictures of my heart rate variability or my sleep tracking or what kind of light hacking stuff I'm doing. Like right now, I'm wearing a laser watch. Usually, I wear it when I'm talking in front of the computer because this puts red light into my system while I'm soaking in blue light. So I teach people a little bit more about these things that I do for myself on Instagram. But if patients want to work with me, I'm doing in-office visits for the patients that are low risk and willing to come in to see us here in the office. But I also do offer telemedicine. Legally, I have to see at least once a year physically in the office, but a lot of things I can do right now are remote. I can order labs. You can go get them done, and we can go over them, via Zoom or whatever platform.
Can you be from out of town, or you have to be from Missouri?
It's a little bit of legal requirement that the physician and the patient, I need a medical license in each of those locations. So
Ah,
currently I'm licensed in Missouri, Illinois, Kentucky, and New York.
nice.
But if a patient is not located in those states, I cannot necessarily be I can't be their primary cardiologist. I can't order them tests, but I can act more as a
Liaison.
second opinion, educational, like, okay, these are some of the tests you should consider getting, I'm not going to prescribe medicines to those people. I'll say, okay, go talk to your cardiologist in your town, talk to your primary care doctor in your town, see if they're willing to order these tests for you. And, if the results are abnormal, I'm happy to kind of jump back on another call and kind of point you back in the right direction.
Are you seeing amazing reversals with the protocols and things that you're using at your office?
I mean, I have, patients' vascular age is improving, their calcium scores at least stabilizing.
Yes.
And, knock on wood, I mean, and some of it might be just a sort of bias on the patients that end up coming to see me. But yeah, I can literally count on my hand how many patients in the past couple of years have had a heart attack that have been working with me and actually following my kind of protocols.
Yeah.
It's on a handful that I can remember.
Yeah. Because these things matter. One of the reasons why I wanted to speak with you is just because I'm so fascinated by the light and about grounding outdoors and being outdoors in the sun, and then all the other testing and things for prevention. I think in the medical field right now, we just don't have a lot of time to talk to patients and give them information that they need. And it sounds like with your program, like you have the time to share with patients, like, this is what's going on. This is why this is important for you to have this. And the knowledge base that you have is amazing. When you think about other cardiologists here in St. Louis who are doing the standard of care, like they're not going out learning all these things about light and sleep and how to eat. So I feel like you really offer a very, very unique gift to these patients. And I want to thank you for that, because I think that, like, it's amazing, because you had to give up something to be able to provide this kind of service for people. I know where you were working, and I know, like, you know, like what that was for you, and then stepping into this role to really help patients in this preventive thing is just an amazing thing that you're doing. And everybody needs, like, it's just an accolade of appreciation. I know, like, people just need to find you, and once they find you, they're going to be better. So
Okay. Thank you very much. Yeah, I mean, you know, we're always going to need acute care cardiologists. I mean, that's where we all come from, all our training.
yeah,
And it's outstanding. You know, if you had the event, you need somebody well trained to put you back together. And it is one of those things that sometimes it does come down to a time thing. The traditional model doesn't value time, and traditional doctor. I shouldn't say traditional doctors, but the word doctor, is teacher in
yes,
Latin. So, my job is to educate the patient, try to put them on the right path, and they go and do the healing. It's not your doctor fixing you; it's giving you the knowledge so that you can heal yourself. And for patients to come and see me in my practice, my new patient visits are 1 hour long.
oh,
You
that's
know,
so
previous
awesome.
practices, those are like 15, 20-minute slots. And in that case, literally all you can do is ask the patient, are you having symptoms? If you're having chest pain, you get a stress test. If the chest pain's too bad, you go directly to an invasive cardiac cath, and then here's your prescription medicines, and then next patient, please. It's really hard to get to the root cause of problems when you don't have enough time to dig into mitochondrial hepatitis and circadian rhythms and timing meals. I mean, that just takes time to ask those questions.
It makes me so sad, like, just coming from a practice where I was able to spend as much time as I wanted, and then entering an environment where we were going to 10 and 15-minute visits. I didn't feel like I know anybody in 10 or, I mean, at that point you're doing a medication refill. I mean, what about all our screenings? What about our lab work? What about all those other things that patients really need, and really just being with you because you're so knowledgeable and the energy that you have. I mean, even that is what helps patients heal. Would you say there's anything like to say kind of as a summing it all up?
Well, I usually say, Mother Nature is very wise, and just get out of her way. So stop and look and see, if you're not well, it's something in your environment that's not making you well. So first, reconnect with Mother Nature. See every sunrise. That's the number one tip. If you can see every sunrise, things are going to start to improve. And then, earthing, grounding, all those other stuff. Yeah, that's all add-on stuff that can help. But, be mindful of your technology. It's great that we can connect. It's great that we can share information online.
Yeah.
But protect yourself from your technology. At least protect your eyes. That let your body heal itself. And then lastly, you're right. Sometimes it requires, more exposure. So ultimately, I've done one kind of demo one. I'm going to do them again once kind of the world starts traveling again. But I'm going to start offering more health retreats where patients can come hang out with me and see how I do it for myself. But it's much a way of show them, don't tell them, because I can
Yeah.
tell people how to do this stuff. But if I show you exactly, okay, I'm up at sunrise looking at the sun. I'm not wearing shoes. I'm now eating seafood for breakfast because of this reason. It's just much easier when you can put those things in context. So likely to do something in November if people are interested.
Oh, that's awesome. I do agree with two of the things that I really take home message for me is get out of Mother Nature's way and let the body heal itself. I really do feel like you, that we are at this place where we take medicine and we think that really makes us better, but underlying that medicine, you still have high blood pressure, you still have cholesterol issues, you still have inflammation, because we haven't really addressed some of the inflammatory processes that are going on. And I feel really strongly about inflammation and the autoimmune part of our health. And if we optimize and get out of Mother Nature, we're able to reconnect our body with what it's truly meant to be doing. So
Agree.
thank you so much. It's been such an honor, really. Like, you're so smart, and I hope everybody finds you. Like, this is a good thing. And I feel like here in St. Louis is where you are. And like, wow. So hopefully everybody in St. Louis, let's go. Let's go see the cardiologist and do some preventive care. Thank you, Dr. Twyman, for being with us here today. I appreciate you immensely, and I know other people will too. Yay!
Thank you very much for having me.